everyone, and welcome to Public Health Musings. I'm your host, Dr. Caroline Kingori, a faculty member and public health researcher at Ohio University. So excited to have another episode. And today I have a guest all the way from Kenya, from Nairobi. So exciting to be talking to her. It's 8 p.m. right now in Kenya. And I'm so glad that she took the time to speak with me so that we can get to know more about her work and how that interfaces or interrelates with public health. And our guest today is Dr. Shikoh Gitau, who's the CEO of Kala, which is a digital innovation company, and it focuses on, catalyzing digital transformation capabilities for organizations across Africa. She has extensive experience with research, design, implementation, and management of digital technologies. And for those of you who know what this podcast is about, you're wondering, how does that relate with public health? So she'll get into some of the things that she's doing where public health is concerned. And we'll get to understand again that interrelationship between public health and different fields that we have out here. So welcome to the show, Dr. Gitau.
Thank you so much. Actually, I wanted to be a medical doctor before I became another type of doctor. So this is quite exciting for me.
Oh,
I can
good.
In 30 minutes, yes.
This is a nice segue then, because my next thing was, I've given you that intro, but could you just tell us in your own words, about yourself, about your journey? How did you get to where you are? I've read a little bit about your journey and I find it very interesting. So, share with us how you got to being where you are and Dr. Gitau as well.
Okay. Thank you so much, Carol. So how did I get back to where I'm a geek? Like I always tell people, I'm one of those self-confessed embracing geek. I love mathematics. I love doing maths. My mom says since I was like in class 1 or grade 1, depending on where you went to school, I loved mathematics and it was my favorite subject. I mean, I see it in my son. Don't tell him he sucks at arts. But when it comes to maths, he's like doing these very complex maths at 5. And I think, oh, he got my brains. I'm so happy. So I loved maths. And so it was a natural pull to doing like more mathematical, scientific stuff and not the languages. I'm not great at languages at all. So as I progressed, I went to high school and I actually didn't know I was good at maths until my high school maths teacher called it out on me. And the way you're 15 or 16 and you're very impressionable. And then there's that one person who actually says something that really touches you. So I remember Mrs. Coyle calls me and I was in Form 3 and she says, you're really good at maths. I want to help you become really good at maths. And so doing this thing every day, I'll do 10 sums and I'll just become better with doing 10 sums every day. And I love math. So I knew I was going to be in a career of mathematics or something to do with scientific because I loved maths, chemistry, and physics. Not biology as much, but maths, chemistry, and physics because they had a lot of maths. I loved them. So I knew I was going to do something with that. But, when you're growing up in Kenya, you're either going to be an engineer, a doctor, a lawyer, or a teacher. There are like 4 careers that you had to choose from. And my choice of career was a doctor. And it's a doctor because I always say there's just something in me. I say it was born in me. I just found the name of it later, of caring for people and wanting to relieve people's pain. And I when I was a kid, I was this child because I'm a twin. I have an identical twin and we were born like at 28 weeks. I have all these allergies. And as a kid, I suffered a lot because my folks were poor. They didn't know what was ailing for. So I was like always sick of one thing or the other. And it's because I was just allergic to stuff and they just didn't know. So I knew I wanted to be a doctor to make sure that nobody ever feels the pain I had when I was a child. But I always say it's not fate. It's as God will have it. I didn't make the grade to go to medical school. I was heartbroken. In fact, we're doing a project with somebody right now in public health. And the lady, I went to her. She used to be a lecturer at the University of Nairobi School of Medicine and also at the Kenya Medical Training College, which is like the lower ranking medical school. And I went to her and said, can I just get into like even clinical officer level type of space because I really wanted to do medicine because I knew this is the only way I could be able to relieve people's pain. And I didn't. But this is like I always say, God ordered these steps for me. And then I got into a program, a pre-university program, because I needed to make the grade, first of all. So I got into a pre-university program where I ended up just loving maths. I think I topped mathematics in that whole year. And I had to choose which programs to go to at university. And I realized that it was a small Christian liberal university, liberal arts university, and they had like 3 programs at that time. They had religion, theology, to be more specific, and then they had commerce, and they had computer science. So I had to choose between these 3 programs. And I was thinking, I love God, but we're not going to do theology. No. Commerce was already ticked off my head like when I was 12 or something. And then, so for me, computer science was like, I'm looking at this program, I'm thinking maths, more maths, then physics, more maths. I'm thinking, this was created for me. So I went ahead and did computer science. And my first class, it's called CSC 101. We did Pascal. That tells you how old I am. We did Pascal as a programming language, and I loved it. I enjoyed actually programming, writing code. I used to code. I never used to think of it as writing code. I used to think of it as I'm manipulating what this computer can do for me. And I really, really enjoyed it. And I did computer science really well, but in 3rd year, I always call it my quarter life crisis, because I got to this point where I'm enjoying what I'm doing. Life is good. I'm doing, my grades are awesome. So I went and did an internship with UNICEF, and they took me to Mukuru. Mukuru is like a slum here in Nairobi. It's the biggest slum. People talk about Kibera, but Mukuru is like more poorer in terms of like facilities and stuff. So I went there, and we were placed to be like peer counselors with people our age. I was 22, 23 at that point. And I'm looking at these girls and I'm thinking, we are the same age. Yeah. What stopped me from being you, apart from like things happening and God just making things very different for me? I was born in Mathare like you. What stopped me from being you? And for me, that's the burden of responsibility of when you're given a lot. And for me, at that point, I was given a lot. Going to university, given the circumstances, I did not take that for granted. With the grade I had, I did not take that for granted. So I'm looking myself, I'm saying, God, you brought me to this place to learn something. And I really had a conflict within myself saying, well, how will this computer science ever help anybody? So I went back to my roots. I want to be able to change the world. And I was feeling like this computer science is not it for me. I went back, finished my university because I just had 1 more year to finish. And I said, I can't work in computer science. I have to go and find something that is more meaningful into changing the world. And I got into, I worked for a small startup that was doing like governance stuff and political governance. And for me, that helped me a lot, like in understanding how politics work. And I realized, no, politicians will not change the world. Politicians will never change our world at all. So what next for me is, how do I change other things? Where do I change? So I started looking at what's the intersection between computing and being able to change the world, because I didn't have a name for it. I just knew I had a hunger to be able to apply my 4 years and my passion in mathematics and computer science towards making a difference in my community. And so I actually literally bumped into this program called ICT for Development. And I'm thinking, it sounds interesting. So I started reading about it, looking at programs. Actually, I've even applied for the Rhodes Scholarship, got in as a finalist, did not get the actual scholarship, was very heartbroken. But it opened up my mind to this possibility that I can actually apply computer science to changing the world. And I feel like that is why I needed to be in that space at that time. Like, I became extremely apolitical, like I don't feed politics at all. But on the other hand, I found my purpose. I always say just applying technology to changing the world. And I always tell people that's my purpose, connecting people to opportunities using technology. And I went off to University of Cape Town to do this program. It was just starting, like literally, I think it was in its second year, not even, no. I was in the first cohort of PhDs that did ICT for D with that program. I found an amazing, like my Professor Gary Marsden. I always call him out because he passed away and it's important for people to remember him. I mean, Gary had done the first piece of work around mobile use and designing for mobiles in the world. So working for this like legend, and his focus was how do we design better products for Africa. And I'm there, I'm like his understudy doing this was amazing experience. We got to do like a lot of stuff. And so that's where my curiosity around how do I apply technology to other places? It's not just building technology for the sake of building technology. It's building technology to change the world. And I know a lot of Silicon Valley type people, I was one of them once, do say, oh, we are changing the world and stuff. This is actually changing the world, that, when you write that code, somebody's going to sleep with a job, or they're going to get money or something. And that's what it means for me. Or in this case, in public health, is that you're going to save lives, like in the actual sense, save lives. I'm not going to get a scalpel and cut somebody up or something. I'm just going to say, if you do this, this is going to happen. If I write this up, this person is going to have better understanding of who they are in health. So for me, that's how I ended up doing what I'm doing, and being able to apply my skill set in different ways to change the world in a spectrum of industries is what I do now. Is like I can apply technology in education, in health, in financial services, in any area of life, because I understand technology and the power of technology and what it can do. And you have to understand, when I was doing this, none of this was possible. Like, this was a dream. Like, my life right now was a far-fetched dream, but I'm glad that I pursued my passion. Yeah.
Wow, that's an amazing story, and I think this is why I do this podcast, because I want people to see what has changed your life, right? What motivated you to get to where you are, but also the art of storytelling has something, with that, and just to see how much you have accomplished in such a short time, knowing, growing up in a community that didn't have much, and knowing how Nairobi is with all the challenges, socioeconomic challenges, and achieving what you've achieved today. It's amazing, and it's extremely commendable. So you talked about ICT for development, and for people who are not familiar with ICT, what does that stand for?
So ICT is information communication technology. So everything digital, your apps, your phones, your internet, that is ramped up under ICT. And for development is economic development. It's not writing apps. It's economic development, making people's lives better, purging out poverty and hunger and stuff that you read in economic type of literature. Yeah.
Wonderful. So I know that with that knowledge, speaking of ICT, last year this year you were recently appointed to the COVID-19 ICT Advisory Committee in Kenya to facilitate that containment of the spread of coronavirus using information communication and technology. So tell us a little bit about that advisory committee and how you are able to utilize your experience in this advisory committee.
I know, like, one day we'll look back and feel like 2020 and 2021 was merged into 1 year and just skip the whole year. But it was actually last year in March. So COVID hit most of Africa early March, mid-March. It hit Kenya on 12th of March. I don't think I'll ever forget 12th of March, because we were seated in the office and the president stood up and said, we are closing down the country. And everybody ran into a panic. I always tell people I panicked for exactly 3 seconds, because I don't allow myself to get overwhelmed by stuff like that. Then I asked ourselves, we're in the office, and asked guys, so what are we going to do? I know we can't go to the office, come back to the office. It was a Friday. We can't come back to the office on Monday. But are we just going to sit around and wait for this thing to kill us or get finished? Because none of them is happening. And so we started looking back at what we had done before. We had done some stuff around modeling for cholera and trying to see contact tracing. Can we do contact tracing using mobility data for cholera? And cholera was a huge pandemic. I try and make sure that I say the right word, pandemic in Kenya. So there was like always every 2 weeks or every 3 weeks, there's a huge outbreak of cholera, somewhere in the city, somewhere in the country. And it was really hard to track where it's starting from. And we're like, technology can actually solve for this. Like, I mean, we can actually find where these people were before they got to this place where they congregated and got COVID, and which of these people actually brought, not COVID, cholera. So we had already thought this through. So when COVID happened and started learning about people doing contact tracing and understanding what is the disease, how is the disease panning out across the globe, we started saying, okay, let's learn about how they're doing it. So we went to Singapore, and so they're doing that the way they're doing contact tracing, and then they're using data to model out where the disease might have the biggest effect. So it's just basically learning and doing research around like mostly Asia at that time and how things had happened in the last 3 months. We said, what if we did some of this stuff in Kenya? And so what we did is we basically said, okay, what are the biggest contributors to death, to morbidity? We presented this to like some government type and said, please don't call it comorbidity. It makes me feel bad. And so we started doing like a comorbidity mapping. So what we did is we took the Kenya population data as a basic and mapped out where all the old people are and where all the poor people are. So basically we're saying, this is a Kenyan map. Here are all the old people, and mapped them out. In terms of intensity of age. Yeah, anything above the age of 58 and above was old, based on the data that we were reading online. And then poor people like, congestion, if like congestion will mean that there's an R0, a higher R0 because of spread. So we started saying, okay, where are all the poor people based on that? And then we presented this because this is the data that was publicly available at that time. And we presented this to like government and say, okay, so if COVID was to hit all the 49 million Kenyans, these are the places that will have the most deaths, mostly because of age and poverty. And honestly, like when I see the Kenyan map right now in terms of deaths and how they have appeared, they've actually appeared in the same exact pattern. It's so weird. And then so we did that first as our first iteration, and then they asked us, okay, this is great, and they started taking actions almost immediately. So we present this on a Saturday. The next thing we're hearing, Kiambu was the highest, and it's still the highest place for morbidity, is they've closed down the markets because of the concentration and the highly likelihood of like passing the virus. So they said, let's close the markets in Kiambu to see if we can reduce any sort of spread that might happen. And so they said, what other data do you need? We said we need actual health data because we need to layer on like comorbidities, the actual one. At that time, we were looking at HIV as a huge comorbidity in Kenya. We were looking at diabetes, hypertension, and any upper respiratory disease thing. So we got access to like what is called DHIS. It's a well-known program database that is used across Africa by many Ministry of Health. We got access and we did this layer. And I think we got so many requests on updating it that we had to get help from like medics and people who understand how like the virus. We are data scientists, we are computer scientists. We don't understand how this stuff work. So we partnered with the University of Nairobi, who provided like the epidemiology part of it, understanding how disease work. And then we partnered with them on like clinical interventions. And so we did this. So we were bringing all the computer science we had. We connected with Uber, with Facebook, with Google, and got all their mobility data. And we are layering this data on top of each other and showing the country almost in real time. This is how the disease is spreading. And our R0 is actually this number that is either decreasing or increasing based on mobility. And so we present this, and the next thing we're seeing, like the president, I get a call and say, can you define for me what Nairobi means? If you are to close down Nairobi, I'm thinking, what does that mean? So we said, okay, let's find a solution. If you are to take all the mobility data for Nairobi and map out every morning and every evening for the past 3 months, what is the farthest point that people travel from the middle of the city? And that will be like our reference point. And that's how we ended up with having like defining this space that is going to be closed down. So we did that for Nairobi, we did that for the coastal region. And by the same thing, if I was like in the center of the coastal region, what is the farthest place that somebody travel on a regular basis? It's not just a one-off like movement, it's like a regular basis. So we did a three-month data mapping. And based on this data, the next thing you're hearing is the president saying, oh, these areas have been closed down, the Nairobi metropolitan, and thinking, we actually defined this. And it, you know, things like that make you very happy. And you're thinking, oh my God. And then you're being asked, what is mobility at these times? You're looking at it and mapping it out. And you're thinking, what is the appropriate time to closing down the shutting down the country at night? And, you know, we tell people this thing, they're saying, oh, you're the ones who stopped us from moving at night. I say, oh, well, we stopped the country from going on up in flames because of COVID. And for me, it's this journey of doing this that made me feel like I'm back to being a medical doctor, because somebody really, I have to find this paper because I read it, I can't find it. Somebody released a paper asking, why did Africa get saved from this huge pandemic in 2020? And one of the reasons they say it's because African countries took like immediate action for prevention, like the non-clinical interventions were really taken into place, closing down the country really fast, containing the disease in some areas, really saved most of the African countries from like a really up in smoke pandemic. And when you realize that you are part of defining that, and you realize you saved lives, and I'm really grateful for that. The team, we sit down sometimes and thinking, I mean, that when you're running a small business, sometimes you think, oh my God, will we get out of like this circle of like being a startup? And then you realize that in 1 year, you've been able to achieve what other organizations out there only dream of in 10 or 50 years. And so that is our story in health. And we started now working with like some startups, some NGOs, in like looking at how do we have digital health interventions. How do we apply? It's not just about a matter of writing an app, and we have to move people from, we are not just writing an app, we are solving an actual problem using technology. Yeah. So working with people around what gender-based violence, what is the impact of COVID on gender-based violence, and showing people this is actually really bad. And we were showing people like, if you combined 2018, 2019, actually we did 2018, 2019, the cases of the incidences of gender-based violence, and compared to 2020, it was more than double those 2 years combined. And you're asking for action, you know. And when you see the Minister of Gender actually standing and saying, we need an intervention around this, you realize, oh my God, visualizing this thing was powerful. And then fighting fake news. So one of the biggest fake news last year was that there was a lot of teenage pregnancy because of COVID. I mean, it was a huge one. And so we went back to the data and said, okay, let's approve or disapprove this particular piece of news because we have the data. And the reported cases of teenage pregnancy actually had fallen in 2020. And there is a caveat there I can put as an asterisk, because there was also a falling of people who actually went to hospital in 2020, which means that it might be true, but most likely if we are to use this data, that is actually fake news. So there was a lot of that, and I got to learn a lot about how to use data to inform policy, an active real life policy, but also long-term policy on how government actually uses data for intervention. And these days when we get like a call, oh, can you guys do for me this? Or can you guys do for me that? It makes me really happy. And to institutionalize this, because I always say one of the biggest problems we have in Africa is we have great ideas, we have great minds, but because we are reacted to this during a pandemic, when the pandemic gets over, we forget about this. So our goal, and one of the things I really wanted and I was pushing for, was institutionalization of this process, such that in 2 years, or even next year, once COVID is finished and we're all vaccinated and we are back to fighting cholera, we already have a mechanism in place to be able to find a solution really, really fast. Yeah, we are all hoping to going back to fighting cholera, but we already have a mechanism in place. Or in 5-10 years, because prediction is saying there's going to be another major pandemic, is you're not going to be scuffling around finding who is going to do this for us. We already have a mechanism in place, put in place, to be able to say we have a group of Kenyans who are able to do this. And that Kenyan does not mean Shikoh. It means that we have created a system to be able to create a pipeline of talent that is able to do this. So we established SEMA. SEMA is CEMA, which is Center for Epidemiological Modeling and Analysis Africa. So it's called SEMA Africa. It's based at the University of Nairobi. It was officially launched by 3 ministries. I'm so proud of that. Ministry of Health, Ministry
That's
of Education,
amazing.
yes, and Ministry of ICT. And it's basically semi-detached or semi-independent organization that influences policy and decision making using data for the government of Kenya, and hoping we are doing some work also in Uganda, and hoping we're going to be able to influence all over Africa. Yeah. So that is how I ended up being here and talking about health and stuff. Yeah.
Wow, that it's amazing. I had some follow-up questions with that too. When you talk about modeling in layman terms, you talked about looking at secondary data from DHIS, and just for the audience and those who are listening, DHIS is District Health Information Software that collects data for reporting and analysis for health programs, and this is across different countries. But there's also DHS, which is Demographic and Health Surveys, that collects data from multiple countries, and Kenya is part of that. And so when you talk about modeling data, what does that look like in a layman's term?
So modeling data is, if you know, like statistics or 101, is like predicting a certain event or occurrence based on certain parameters and variables. In the case of COVID, we were saying that modeling future occurrence or increase or decrease of COVID in our population will be determined by a number of things. One of those things is mobility. Mobility means people movement, yeah? And people movement is like, Caroline is going to move from this house to this house. If she has COVID, she's going to be spreading it. So mobility is number one of them. Population, in terms of how many people are in a certain given population. So if Caroline has COVID and goes into a household with 10 people, those 10 people are going to get COVID as opposed to 1 people. So for example, places like Kibera and Mukuru and Mathare, where there's high intensity population, there's going to be a likelihood of high numbers of occurrences because people are spreading it really, really fast amongst each other. And the third one is time of entry. I think the time of entry of the disease. What time it came. So it's how it came, how it moves within that population, and the amount of people in that population. So that is what efficacy. Yeah, and that's what defines how fast a disease. So that when you look at those 3 things, it will tell you, given the efficacy is the type of the disease virus. So for example, right now you're hearing there is alpha, beta, delta. So alpha was what we had first, the one that came from China. It was spreading really, it was spreading, but not as fast as the delta. So the more it mutates, the more it spreads faster. So basically, and the more it spreads amongst different people. So the one thing I've learned, I knew nothing about medicine, is I learned that some viruses or some mutation of viruses spread faster within certain populations, lesser than other populations. So the argument is like alpha did not spread amongst the African population because of something, maybe we are too dark or something. The sun killed it. There are many like reasons for it. The beta version, the one that came from the UK, was actually quite, it was the one that had the most effect as far as I'm concerned in Kenya. Yeah, because it killed a lot. Our second wave was by that one, and it killed a lot of people. It had a big effect on people. The Delta one, we are all afraid of. We are yet to feel the effect, at least here. It's cold, we are all afraid, but we're yet to feel the big effect that the beta one had. Because the beta one, every second person had somebody in their family die. Uh, but the Delta one, I've not felt that much effect, at least from my circle of people and the people that from like the places I've been working in. And the data
Right.
also does not show the same as much as the beta one. So so the type of virus also determines what the R naught is, the spreading factor of a virus looks like. So all of those combined determine, that's what you model to tell you we are going to get a second wave in X amount of time if we don't reduce mobility. So that we say, oh, wear a mask, because when you wear a mask, it stops the virus from moving from one person to the other. Social distance, which means that it cannot move from one person to the other. Stay at home means that if you stay at home, you're not spreading the virus, or you're not getting the virus back at home. So yeah, those are the things that we model. Yeah.
That's an amazing explanation. And now that we have this vaccines, we're hoping that would sort of help reduce that negative impact. But we still have to remain diligent because of that mutation, and we don't know what other virus is going to come after Delta, and so we can't really be like, oh, we're fine. The good thing with vaccines is that it reduces the severity of the illness. It's reducing the number of people who are dying compared to what we saw with beta and alpha. But it's good, again, to see that you're still keeping tabs on mapping and modeling how this virus is spreading. And we've seen an increase in Kenya and other countries in Africa, even after we were so excited in 2020. And we're like, oh, something, in the system, whether it's being exposed to other infectious diseases. There was some theory about the sun. But now we are seeing some of that being debunked because of these different mutations that are coming up.
Yeah.
Okay, so when you think about the work that you did, the presentation that you gave to this advisory committee, and with your work with the modeling team, how do you feel about the implication of what you have, the work you've done, and the work that has been done by other researchers in Kenya in terms of enhancing the prevention strategies? I know masks have been a really contentious issue. And, Kenya tried to even enforce police to make people wear the masks. With a shutdown, it had to be opened after a month when the president shut down in April, I think, or March of this year, the second round of shutdowns. How do you feel about your recommendations to the advisory committee and how that's being implemented with the prevention strategies?
So I told you at the very beginning, I'm very apolitical. Like I always say, if you want the change, you do it yourself. Don't expect the government to do it. If you want to educate children, I know that we have like a free education policy and stuff, but whatever money you can save, just educate one child, you'll be changing their world. I have that kind of mindset until last year when we are doing this work and you're seeing the government actively adopting scientific approach to COVID. And I was really impressed. I got to meet some very, very smart people, like super smart people working for government. I got to see government being curious and asking really inquisitive questions like, when do you think this is going to end? How is it going to affect our economy? How is it going to affect our public health system, which is like on like threads and gum? Like how do we, like they were asking these really deep questions, and then you realize that actually, yeah, they're listening, and it changed my mind totally, 100%. I'm not committing to working for government, but it changed my mind around how we perceive government. Because I feel sometimes we just are like hard on government because they're not doing our bidding and our expectations. But what other things are they doing? So for example, today we're talking about somebody and we're talking, oh, can the government do this intervention? And I said, you see, the government has to balance between X and Y. So for example, if you have 10 beds, ICU beds, and there are 15 people needing those beds, they have to balance between they have to balance who's going to get those beds on who is it. So if you're an 80-year-old guy and you're sick, most likely you're not going to get that bad, because there's a 25-year-old who has more productivity in them that might get that bad. I mean, and that's just an example, just balancing that act. Are they going to be able to say, we're going to take more kids to school, or we are going to run yet another school feeding program? They'd rather pay teachers to go to school and your parents just send your child to school with lunch, like things like that, that the balance, we have to balance, and they have to be on top of mind of a government official every day, or for CS, for PS, for cars. Those are things that they have to be balancing in their head, is what's best for the population given limited resources that I have. And so the other argument you were talking about, does the government take a loan or not take a loan? And then you realize that the government employs 250,000 people. Yeah. And those 250K people have like all these other dependents. So the government itself supports like a quarter of the population through directly or indirectly through employment, not through taxes and other stuff. So you're saying if you don't take a loan and pay these people, we are just basically saying, yeah, like 10 million people or something will not be having a livelihood. And so when you think about things like that, I got to learn this because I was just deep in data, understanding how government works, to be able to say, I can't be pointing out fingers when I'm supposed to be supporting government in data. So meeting these smart people, understanding the balancing act that the government has to do with their limited resources, gave me an appreciative of who government is. But also it made me understand that you have to go with a solution. You can't go and throw Twitter stones. We are very good at throwing Twitter stones as Kenyans to government. Go with a solution. And I promise you, the government will listen. And if they can apply it, they will. I have seen it real life. Like I saw it, and cannot convince me otherwise. Yeah. So we took a scientific approach to all of this, and government actually took a scientific approach, and it had dividends against COVID. And what other way to convince me, I'm a political person, that government works? Yeah.
Wow. You're right. I think with COVID, there was that pressure for governments to really pay attention to what could be done in a timely fashion, because COVID was wreaking havoc everywhere. It's livelihoods, it's people's health, it's the economy of the countries, it's the health systems, like you said, that really are not systems. We're talking about fragmented systems. And so it's a very tricky dance when we think about the social services that we expect the government to, do something about and allocate funds to those services, while they still have other things in their national budget. But I think the key here is, again, to hold them accountable. And like you said, is, what solutions can we provide? There's no guarantee that they will take those solutions. But that ability to listen and hold them accountable, when they say, this is what we're going to do, we're going to have this many jobs for young people, keep reminding them about that. And the importance of allocating funds. But yeah, we know governments are not the best friends of a lot of communities. But we can see that there is some effort. And as constituents, we also need to play a role, like you said. What can we do where we are with our own communities? And so I see that, you identified a few gaps. Do you see any other gaps and opportunities when we're trying to utilize data for policy decisions, and how can we deal with some of those gaps?
So the one thing I'm committed to, and this is something that we spoke about with somebody this week, is democratizing data. Data is public good. Like it's the right of any Kenyan to be able to go and query how many doctors do I have in my county? What's their qualification? Are they being paid well? How many cups of, I'm not sure what medicine, cough syrup was supplied to my county? Have they been utilized? How many, very basic. It's the right of every Kenyan to have this kind of information, and you do with it whatever you want to do. That accountability cannot happen from a place of vacuum. Yeah. So I'm committed to being able to democratize this kind of data, from health data to education data. And this is publicly available data. You can actually find it somewhere on the internet if you search a little bit harder. So, and making it public to people to be able to make the kind of demands or asks to their government, yeah, or keep them accountable, yeah. So I mean, the other day, there's a project we are doing around county governments, and I was looking at like county governments being digital, and every other county government actually has a website. Not nice, but our website. That means they have a digital presence. So the next level is asking them, can you make it transparent in terms of, this is the budget we received, this is how we have used it. And that is one of them, them saying this. And then somebody else keeping an accountability table and saying, government of county of Nakuru, which is my county, has said they were given X number of amount of money and they used N on health and they use it on ABCD. Can we go and actually verify that this is actually happening and put a table out there? Which means there's a make a checkup process. You're saying government is making the data, we are checking the data if it's verifiable. We are taking pictures, making very open and transparent, such that we take, we actually, as somebody said, I'm not going to quote who, these people, our employees, the governors, the civil service, we pay our taxes, and so they are our employees. We need to keep them accountable. If you had employed somebody and you've given them a budget, at the end of the year, as the board, what do you ask? How did you use the money? If you didn't use it completely, do you get a budget cut? Yeah. Or so it means that if they've not utilized our money from last year, we should all get a tax break next year. Like, honestly,
Right.
things like that, that make that accountability real is what I'm hoping that we can do. And by starting with health and showing this county was given an amount of money and they say they had 100 ICU beds and we are seeing 3. Where did 97 go? You let us know. And that keeps accountability there. We are still a long way from getting there, but we can start. We need to stop tweeting and start doing stuff. And that is my way of, and tweeting has its place.
Right.
The Twitter gang come after me. Tweeting has its place, and especially Kenyan Twitter has its place in society. But if you are a doer, do something about it. There are people who have been created to do it's called advocacy.
Right.
Let them do that because they are good at it. Me, I am a doer. I feel like if I talk a lot, I get tired and frustrated.
Right.
But if I can do something, let me do something. Yeah.
Yeah. From what you're saying with Twitter, I think I understand that you're asking for people to use it more as a platform to rally people into action. Yes. Because with social media, you have access to a wider audience. So in addition to pointing out the problems and the challenges and the issues, and then see what can we do, as a community. So maybe the government is taking its time, right? Meeting some of those needs. What can you put together as individuals? And as a community, how can you go to your chief, your district officer, I don't know if that's what they're called, your governor, and ask for those questions to be answered, as opposed to always just targeting them at the president. Sometimes you just won't get the answers you want. But I agree, accountability is really important. So if there's a way we can rally our communities together to solve some of these issues, that would be extremely helpful and beneficial, right?
And they're open to. So for example, this training that is happening, it's a fellowship. I just called my local CEC, and I know there's a point of privilege that I have to admit I have, because
right.
I where I am, that I can call somebody and they can pick my call. I said, okay, you're applying for this thing, right? And said, okay, I'm applying for this thing. Because you have to open them to those opportunities for them to grow in places where that in overall it will improve the health of the county, not health in terms of like medicine health, but health in terms of the totality of the well-being of the county. You have to be proactive around it, because some of these people are smart. They're very smart. They didn't get there because they're dumb. Okay, some of them did, but even the dumb one got them because they're street smart. But they're really smart. They're well educated. They just need somebody else to nudge them towards the right direction. And for the willing one, which are a majority of them, they'll be willing to take a step in the right direction.
Right.
Yeah. Human beings are the, yeah.
Yeah, and especially right now with the vaccines, there's so many questions with the constituents. You know, World Bank, WHO is giving all this funding, and everybody's like, "Where are these vaccines? Why are we still not getting them?" And so those are questions that need to be answered if we're going to reach a place where we can protect, our country and other countries that also are sort of having challenges with mitigating this infection, right?
Yes. No, yeah.
So go ahead.
And I say, yes, we have to. And it's going back to democratizing this data. It's being able to go and say, we are going to scrap off data from the internet and analyzing for ourselves and making this data public to people who need it, or breaking down information in my local language. It does not take me long. Okay, it might take me particularly long to translate to Kikuyu, but if I have the will, I'll sit down and translate Emwe, Gere, like that. I'll just do it until it's done. But we have to take some action ourselves. And I know Kenyans are like, oh, the government, we're paying taxes, they should be doing this first. Imagine, guys, if you don't do it sometimes, you not challenge them to do it. So this data thing, for example, we did for SEMA has started a movement within Ministry of Health where everybody's like, where's the data? How can we visualize it better? How can we use this better? And that is because just a group of people decided, you know what, we can do this better. And we're going to do it. We're not going to ask a coin. We're just going to do it. And it happened. What can you do? And then activate your local government to do something about it. Yeah, you're smart. Do something. Yeah.
Right. That's a great challenge. And it's true, sometimes you just have to be proactive. But data-driven decisions are really important. And sometimes even to go down to the communities or to go where they are and find out if this data is really representing, what's happening. Vitu kwa ground, right? You want to see you want to see whether what's happening on the ground literally is what is being represented by the data, because sometimes the data can miss that if we don't capture those salient thoughts and issues that people have. So let's talk a little bit about your organization, Kala, which, like I had said before, is a digital innovation company. Tell us how you decided to form this organization. You kind of mentioned some of the activities you engage in, if there's anything else you want to talk about, and what you've accomplished to date.
So Kala is a digital innovation lab. We like calling ourselves lab because a lab gives you the opportunity to experiment, to fail, to take some risks, to do crazy stuff, but also to be able to have impact. Yeah, the goal is, bottom line is profit, but also bottom line is being able to have an impact, especially because you're operating in Africa. And we are two in one company. So on one, we have like a venture builder where we work with people with great ideas. So for example, you're a health person and you've been seeing this problem persistent for a long time and you want to solve it using technology. You've seen that, oh, we can do something around this. You come to us and we're able to work with it. We complement you from a technology point of view. We become co-founders and build that. On the other hand, we have like a innovation consultancy where we work with big organizations, small organizations, to help them like through a digital transformation journey or build innovation capabilities. So in this part, where we are very deliberate and very focused on what we do. We always say anybody who wants to do anything in Africa around digital needs to talk to us. Anything from just understanding something. So we do research, and our research is three-pronged. We want our research to inform policy. We want our research to inform programmatic interventions and to build products. Yeah, in that way, we're able to say, are you coming as a government or an INGO or a donor organization and want to do something around digital in Africa? Let's take, for example, we want to start a digital skills program. In terms of a policy point of view, what does that mean or look like? So you come to us and we work with you, do research, understanding, get insights on what a digital skills program will look like for Africa. The second one is in terms of programmatic intervention, and we've had a lot of these, is where I have 20 billion I want to use on Africa, and I've seen technology is the future. Where should I put my 20 million? Yeah. and we work with you in finding what are the key areas that you should be looking at. And if you focus on one area, say, actually, you need to tweak your thinking around this, because what you've been thinking is very like American or Silicon Valley type of thinking. This is actually the reality on the ground. We've talked, here are the voices. We talked to 100 people. Here's our input. And the third thing is product. And we have had a lot of this. Is actually more than anything is that, oh, I have been thinking about this could work in Africa. And you're thinking, no, it won't work. So you come to us and say, can we just understand what problem you're trying to solve before we build any products? So usually that throws a lot of people back. Some of them never come back. They go to somebody who is less questioning about their methodology, which is fine. We don't want anybody who is just thinking they're right. We want to work with people who are able to be questioned and listen. So when you ask you what problem you're solving, if it's not clear, we work with you to defining what that problem is before we define a solution, which in this case is a tech or a digital solution. So that is on our research. So we have an amazing team of software engineers and data engineers. So we build both software and platforms and data products. So those are three different things. So software is your website, your apps, whatever. Platforms is things that are the underlying, they power what you always see. So for example, we are building, I don't know if I'm supposed to say that. Okay, let me not say that. So we are building a number of things that power other things. And then the data infrastructure, we help like organizations who are going into data to build proper infrastructure, and not necessarily from scratch. We can rely and build upon, work with other organizations, like we can work with Google, or we can work with Amazon to build infrastructure around this particular organizational need. And finally, data. I've already talked about data engineering, which we do under engineering, but we also have data scientists and data analysts. And their work is to be able to look at huge data sets, small data sets, your organization in terms of needs, and see what do you want done and solved using data that you might already have, or data that we can try and source from other places to complement what your current needs are. So that is Scala. It's been an exciting 18 months. We started in January of 2020. And I mean, I'm really grateful for the journey we have taken so far. It's been hard. Being an entrepreneur is very hard. I always tell people, if it's not a calling, don't do it. Stay with your paid job. Assured salary at the end of the month is great. But also for me, it's a fulfillment I've had. First of all, the impact that we've had in our community, in our country, in Africa. There's some projects that I'm not yet able to talk about that we've done across Africa that have like had an immense change in things that would have gone totally wrong if we had not been the place we were at the right time. On the other hand, it's my team. I absolutely love my team. And seeing young people thrive is amazing. And I'm telling you, this guy, he's a data scientist, and him hearing the president read his work, I think changed his mind completely on what he's able to do with his life. And there's nothing like being limited. The possibilities are immense. And he said, knowing that I'm young, the president read my work. We changed the world, saved lives. Yeah, so for me, that change in my team has been like seeing them grow from like insecure young person to this super confident data scientist gives so much joy to my heart. And that's just one case. There are many, many of them the people who work in our research team, who at first being somebody with a PhD, and we have a couple of PhDs, but when somebody is sitting in the West with a PhD pushes back at your idea, you feel like you're dejected. But then telling them, but you're the one who's here in Kenya, you're the one who's doing research. Did you talk to the 5 or 20 users? Yes. Did you? What did they tell you? All right. So why are you feeling afraid about saying that? You're the authority at this. And then pushing back once and feeling like they're going to die, pushing back. And then the next thing, I don't know why I go to these meetings anymore, because they're thinking, my work here is done. You're actually doing what I was supposed to be doing, helping you like get your work done. You're already pushing. I say, no, but the user said this, the customer said this is the voice you're hearing from the customer. And hearing it, you're feeling like, oh my God, you have actually grown. Makes me very happy. So those are the things that we have grown, and what makes me wake up in the morning are those things, just the changes they're seeing. So we're working with government on one hand, which I've talked a lot about. We're working with industry, very private sector. We're working with NGOs. We're working with religious organizations, churches, who are going digital and sitting down with pastors and saying, okay, are you going to go and join TikTok? And them looking at, first of all, what is TikTok? And what's the impact, and telling them, TikTok has like these, TikTok, as by 2020, they were having like 1,400 downloads every minute of videos. They're saying, so you're missing a lot in preaching the gospel using TikTok. And they're like, you're right, young lady. And the next thing, the pastor is on TikTok and having 6,000 views. And they're like, you are very right. So for me, examples like that, changing mindsets. So yes, we're starting with TikTok, and then you're going to build products for them. But it's so that change of mindsets and moving people from a place of total ignorance and naivety to a place of technology can actually change for me. The same with government too. Yeah, what are these numbers? I remember the first time there's somebody we presented to and said, how will this help us to, can you do this for me again and again? So for me, those are things that make me happy. Yeah.
Wow. No, it's really great to hear that, seeing the diversity of your portfolio, and seeing how, you wanting to be a medical doctor and then going into this ICT field and then coming back into health and development and policy and decision-making process. So I feel like you've sort of gone 360. And that depth of information that you have is really, really impactful.
Yeah, thank you. No, I thank God. I don't take for granted that. Yeah.
So thank you so much for, speaking to us today. You told us what makes you tick and what makes you get up in the morning. You've given us some of your memorable things, when you impact that confidence in someone, and you see that they come alive when they see the fruit of their work. That's something that goes a long way in making you feel like you're making a difference in someone's life. And for you to give us such an in-depth perspective of how technology plays a huge role in health and the decisions about health. And for a long time, in the past, we had all these fields in silo, but now we are finding we all have to work together for the betterment or for the good of the communities that we are working with. And technology is something that's really near and dear to me. Think about some technological interventions with youth, and it just doesn't have to be an app. And I like that you focused on technology is not just reduced to an app. There's so much more that can be done with technology to inform decision-making processes. So as we wind down, is there anything else you wanted to add to this discussion? A question I didn't ask, or information you wanted to provide?
So I think for me, the one thing I have learned this year, 2021, because as I talk about COVID and the impact of COVID on other people, last year was just a matter of numbers for me, crunching them, presenting them, visualizing them. And it was those numbers. And I have my friend Thumbi, he's Professor Thumbi, he's one of the collaborators for SEMA, sent me a paper saying that we should not desensitize ourselves, that these numbers, every single number represents a life. So there's one thing reading it on a paper, and there's one thing it happening to you. And when this year actually lost a number of people to COVID and to cancer, because COVID makes cancer even more intense. So they will say the person died of cancer, but in actual sense, COVID like just exacerbated the speed. Just the being present, being vulnerable, allowing yourself to feel the pain to heal has been one of the biggest things I've allowed myself to do. I've never done it my whole entire life. Just allowing yourself to feel the pain and not wanting to move on. So no, not stilling yourself. It's called stilling yourself until you felt the pain. Is very important. And I feel like medics and maybe people in public health, sometimes they disassociate themselves because of you deal with this stuff every day. But for me, just sitting still and allowing myself to feel the pain completely until it had gone through my system several rounds, and allowing myself to know that these numbers are numbers. I can say if they're saying 101, that one person is a person who is close and dear to me. was very important, and just being able to be vulnerable and allowing the healing process to happen to you has been the most amazing thing that has happened to me this year. And I feel like that's the one thing I tell people. The one lesson I used to tell people: be kind to yourself, because I'm usually very kind to myself. But I always say, allow yourself, because all of us go through stuff, go through pain, and we want to move on as actually, I'm a choleric. I'll say I want to move on as it's going to distract my life. Let's move on. But that just the gift, give yourself the gift of stillness and vulnerability, yeah, and allowing yourself to feel the pain and healing, and just pray to God that you get that gift, because then you at the other end of it is a much better version of you. Yeah, that is what I want to say. Yeah.
Wow, that's a really nice way to close. And you really emphasized that ability to be whole, and not just focus on yourself as a professional, which is half the time that's the identity we associate with most of, and we don't want people to see the other side, because we don't want to be vulnerable. But authenticity comes in showing, or being able to feel and appreciate and accept those things that cause us pain emotionally or psychologically. So this is great. Even from a health perspective, it's important for us to enjoy maximum health, wholesome health. We have to think about that physical, mental, social, and psychological aspects of health. And I'm glad that you pointed those out. So how can people get in touch with you?
So it's very simple. I have a very simple online ID. So on Twitter, it's at Dr. Shikoh. So it's at DrShikoh at Dr. Shikoh. On LinkedIn, I'm just Shikoh. I'm very simple. On Instagram, please don't contact me with Instagram. Instagram is for me to see what my team is doing on Instagram, because they're always posting me. On Instagram, I'm Dr. Shikoh as well. So my identity is usually Dr. Shikoh, apart from like on LinkedIn where I had Shikoh and I didn't want to change it. So that's the base to, and those are the only social media platforms I am on. I try to limit myself to 3. So yeah, and you can email me on Shikoh, SHIKOH.Gitau @kala.com. So Kala is QHAL.com. Yeah.
So email is Shikoh, SHIKOH.GITAU @KHALA.
QHALA, not K.
QHALA. Why I confuse those two, I don't know. So I'll repeat that email: SHIKOH.GITAU @QHALA.com, right?
Yes.
Awesome. And for your website, it's just kala.com, right?
.com. Yes.
Okay. Great. So go visit her website, send her messages, emails, questions that you have for this impactful work that she's doing. Very impressive. And we commend you for being part of that decision-making process, especially at a time when the pandemic turned the world upside down. And it's good to see just your contribution and your desire to be proactive, even when things don't look so good on the decision-making part of the government, if you will. And thank you to the listeners. Thank you to the viewers. Again, subscribe to the different podcast platforms: Google Podcast, Apple Podcast, Spotify, and then also subscribe to our channel on YouTube, and that's Public Health Musings on YouTube. We just started that channel so that you can get to see how it feels for us to engage with each other, but also to share with your network. So thank you again, Dr. Gitau. I look forward to following up with you at another time.
Thank you so much, Caroline. Thank you.
All right. Have a good one, everyone.